All right, hello guys. So this is the lecture about health literacy. So we're looking at our ability to communicate with our patients and then also how much they remember of what we communicate with them. So again, what is health literacy? Again, it's the capacity for that person to obtain and process and understand the basic health information. And again, this varies. So again, we may be treating somebody who's a physician, which they may have a high understanding of information. But again, you also may be treating somebody who, again, while they're not dumb, and they probably are very smart, maybe they're a plumber. And so their knowledge base is a little bit different. And again, I'm not saying that plumbers are dumb. I'm just kind of giving an example about how different it is. I mean, I had a friend at one point who he was super smart. He just decided not to go to college, and he actually did a lot of plumbing stuff and did some underwater diving um, and welding kind of activities. Smart guy, but again, some of the stuff that he talked about, he didn't understand initially. Um, if you explain things to him, he got that information quick. So again, sometimes we just have to change how we discuss stuff. So again, the average consumer is not going to be familiar with most of her health terminology. Think about you day one in the health terminology abbreviations class that Adrian teaches. What did you know about some of those words? And some of you may know a lot, and some of you may know very little. But again, so a lot of that information is new to most people. And also we need to watch out how much terminology we use and how much jargon we use. So patients don't understand or forget about 40 to 80% of what is typically done in an office. So, I mean, that's a wide margin. Please take that number down, 40 to 80%, because I'm going to have you post it in a discussion board, and that's how I'm going to track that you watch this video and we're here for today. So, what should we do about this? Well, again, assess the baseline of the patient's understanding. So I'm just talking to them and just see if they understand. A lot of times on our intake questionnaire, we may know what job they hold, but it just sort of ask them questions, kind of like we've talked about before with active listening. So you telling them stuff and asking them questions and making sure they understand stuff. Use plain language. Again, try to stay away from a lot of jargon as much as you can. Yes, there's some anatomical things, but we wouldn't say the glenohumeral joint with them. We may just say the shoulder. So again, use plain language. We will also reinforce this as you take comps, as you go forward. Kind of make sure that as you talk to patients, you're using plain language. Again, as we've talked about, ask questions. Teach back to confirm understanding just basically means to have them, if you demonstrate something or show them something, have them show it back to you so that you know. Try to keep with the key points. Try to, again, hit bullet points. You want to give them enough information they know how to do stuff, but not so much that they get overwhelmed. And that's why when you sort of do a home exercise, clearly write it down. I know nowadays maybe that is not as frequent. Maybe there's something online that shows them, or maybe you take a little video, but a lot of times still you may print something out. Make sure those instructions are clear and concise. Why do we want to do this? Well, again, we need to give them the information that they need. We want to make sure that as we do stuff that we're getting verbal consent, so we need to make sure that they're understanding how they're doing this stuff, but we're also making sure that they are understanding the negatives about things. So again, we don't want to just lead them down the garden path, so to speak. So example, again, the patient's just been diagnosed with diabetes. You can state before you go, you tell me about what you know about diabetes. So again, fill that information. The same thing you will start learning about, like hip precautions for total hip arthroplasty. It's very common to really make sure and drill into the patient those hip precautions, because if they break them, they could actually redislocate their hip, which is not a good thing. Again, using plain language, we're going to avoid that medical jargon. So we're going to talk about chest pain instead of angina. We're going to try to keep, again, things from being very vague. Again, I think sometimes we talk about things and we want to sort of be nice and kind of cushion them. we sort of want to be a little bit blunt, a little bit terse with how we say things. So again, there can't be multiple meanings given to them. So you don't say such thing as you should get some exercise. You tell them what you want. Okay. So you say, I want you to walk for 30 minutes, 3 or 4 times a week, so you make a light sweat and you can still carry on a conversation. So again, making sure that you give them clear information so that they know. And again, avoid terms that have different meanings. In medicine, so the normal conversations such as gait or negative. So again, we want to make things positive, so that they understand. And again, we don't confuse them. And again, ask questions. It's always a good thing is to ask questions of the patient. I know sometimes we tend to be rushed in treatment, but again, it's always finish up, leave a couple minutes, give them a chance to ask questions. And if they're not asking questions, you can maybe prompt them with some questions of your own and then see how they answer them. And again, teach back to confirm. So this is particularly with home exercise programs. It's always good that if you show them something, demonstrate something, have them demonstrate it back. That's always a good plan to have. I know, again, we get rushed sometimes and we want to give them a home exercise program, and we may give them the sheet that shows the order that they should do things in and how to technically do it. But again, there are some nuances there that we need to make sure that they get. So it's always good to check, have them teach it back. And a lot of times I also use this method to see if they're actually doing their home exercise program, because I may walk them through teaching the home exercise program, and then they come back and I go, well, are you doing it? And they say yes. Well, I may say, hey, then show me how you do this. Let's make sure that you got all the nuances down, the techniques you want to see. So again, here's some nice steps for teaching back. Again, we want to make sure that they are understanding what we're doing. We're making it very clear. Yes, this a little bit. See it. A little bit wordy, but again, we want to make sure that we're hitting those points and they are very clear on what we want and how we want them to do it. And again, focus on those key points. I mean, you're going to say lots of words, but again, remember, kind of put step 1, I want you to do this. Step 2, I want you to do this. Make sure also if you give home exercise program and instructions that you're using similar points. So don't give them a bullet point when you're teaching it to them and then change the bullet points when you write it down. Again, try to keep it clear. This will get easier as you treat more patients and start understanding what you want out of them and gain experience. I know this may seem a little bit overwhelming right now, but I know some of you have worked as aides or taught people things. Again, so you'll be a little bit ahead of the game, but again, you just want to keep it nice and clear for them. Again, give them clear written information. We've already sort of talked about this, I think. Yeah, I can't remember. So with home exercise programs, I mean, nowadays, if it's their phone, you can videotape you doing it or them doing it, so that they have it clear. But even talking through that videotape, so again, you're hitting on those key points. And again, even if it's online, there should be some sort of written key points on there. And even, again, little asterisks, remember to kind of things are always good. So that they, again, are doing things properly. We don't want them to hurt themselves. So this is works cited. So remember to post in the discussion board. I'll put up here what that percentage was. And again, that was 40 to 80% of the people forget the information, or they forget 40 to 80% of the information. All right. Thank you. And then also remember to look for the your professional communication as well.